So here I am again in front of you for today's class that we have discussed earlier about the whole spinal column from cervical to the thoracic to the lumbar to the sacrum to the coccyx. So now today we are going to talk about appendicular skeletal system. If you guys remember that when we have discussed about the classification of the skeletal system, there is two classifications. The skeletal system classified into two parts, axial, appendicular. Is it? Axial and appendicular. In the axial we have discussed about the component, skull, spinal column, ribcage, sternum. Then we have discussed about the spinal column, the all components. Now today we are going to discuss about the appendicular, that is your limbs or extremities. So what are the different components that forms the appendicular skeletal system? So here we go about the appendicular skeletal system. So limbs or extremities. So starts with the upper body, the limbs or extremities that we call the shoulder girdle. So shoulder joint people use it. Shoulder girdle is a groove where the two or more than two bones combines together. It's a type of groove. Now the question arises that what are the different bones that forms the shoulder girdle? So upper body we have, right? The shoulder joint, as you say in general. So in the shoulder girdle, the three bones that combines together, that forms the shoulder girdle. So we say humerus, the arm bone, the clavicle, collarbone, scapula, shoulder blade. So these are the three different bones that forms the shoulder girdle. If you look at here on the skeletal system, guys, right? The three bones. If you look at from the front, this is the S-shaped bone that you call the clavicle or collar bone. If you look at on the side, this is the bone like a head. This is the head of the humerus, the arm bone. This is the humerus. If you look at on the back, this is the scapula, the triangle-shaped bone. So the scapula attaches to the clavicle and humerus attaches on the groove of the scapula. That forms the shoulder girdle here. So now the most important thing nowadays is the shoulder immobility, right? Shoulder immobility due to lack use of your shoulder joint. The shoulder joint is like a ball and socket joint, guys. It has maximum mobility. It permits the maximum mobility to this joint. So this is, if you see, in this area, in between this area, so many structures we have. We have a capsule, the outer covering here. We have a ligaments that connects these different bones together. We have a bursa, the deep connective tissue. We have a synovial fluid inside, that's why we say it's synovial joint, which gives you more mobility to the joint, viscosity to the joint, more lubrication to your joint. So the problem is the restriction on your shoulder joint, immobility. People have a problem to go like this, oh, pain. Bring it back, pain. Here, up to that range. So if I ask you to do this movement, flexion is okay. Flexion is easy for you, everybody can do because as we are lifting the things in activity of daily living. Extension you can do, not too much. Abduction you can do. Adduction you can do. But we never focus on the rotations. We have a rotation also in the shoulder joint. That we say internal and external rotation. If I ask you to place your hands, place your elbow close to your trunk and do this movement, this is easy. Keep your elbows close to the trunk and try to get your forearm out. What is happening here? This is the problem for everyone nowadays. External rotation, because most of the time shoulders are internally rotated. This is easy, right? If I ask you to do this, here you feel tightness, right? Some restrictions, some limitations. Sometimes what happens, you're trying to go for the backward bending. So if you have a less shoulder mobility, problem with the backward bending, because backward bending doesn't mean only this much is the shoulder end and you're trying to force your pelvis like this. This is wrong. When you're opening of the chest easily, external rotation of the shoulder, you can go like this way, less pressure comes to your lower back. So that's why the most of the injuries happens with the beginners, so take care of it. Like people they are going for the shoulder like this, only this much, right? And they are trying to throw the pelvis forward. So then the pain comes, injury comes back again. So we must have to take care of it. Simple stretches you can do. For the shoulder, you use the strap here, right? Mostly I have seen most of the people try to do whatever the good range of motion you have, whatever the good range of flexibility you have, you can take that much distance of this strap. Not too much shorter, not too much longer, right? Where you feel comfortable. No pain. No extra pain, right? Stiffness, you can take it easy. That slowly the stiffness can be released. So sometimes you have seen that people try to do this. Do this. You are doing coming and going back, coming and going back. This is okay. But if you see, the shoulder has a big joint. Shoulder is a big joint here, right? And it has a big muscles too. If you are just coming and going through this rotation or through these circles here, if you are coming and going, nothing is happening because you are not holding a stretch reflex here. If you want to feel the deep shoulder opening from here, guys, the exercise is okay, but the pattern is wrong. We must have to be hold. So we start from here, hold it here for 20 to 30 seconds, hold it here for 20 to 30 seconds. Here you can feel something is happening inside my shoulder muscles, deep to my shoulder joint. And what is happening here? External rotation. Then hold it here. You can feel I am feeling deep opening on the front of my chest muscles. Then go here, 20 to 30. Here you can feel more deeper. So externally rotation, right? External rotation, then release. So then you go back, 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 back. So hold. It's not only just go, come back. Go, come back. It takes long time to reduce the stiffness from your shoulder muscles. So it's better to hold. Hold it for 20 to 30 seconds on each and every component. So this is most important, guys. Like if you want to use the strap, use it. No strap, you can use the towel. No towel, you can use the bed sheet. No bed sheet, you can use the big hanky also. So if you don't have anything, just try to hold your hands like this way. You can use the stick also or the broom. Go like this, hold, hold, hold. Make sure, because of the shoulder mobility, don't try to do this. Don't overarch your back. That is wrong too. Because we are working on the shoulder muscle. We are not doing any pressure on your lower back muscles. So this you can do easily, right? Then for more the shoulder opening, you can use the wall. Just place your hand like this and do this way. You can go slightly closer, but not creating any pressure on the shoulder here. Just take the step. Sometimes people try to do this. So in this position, what happens? The whole pressure comes to the shoulder ball and socket joint. So take your one leg forward, so you can feel the more stretch, more deeper stretch this way. One leg forward, no pressure on the lower back. and open the shoulders slightly. So this way you can do. Sometimes people try to do this also. They are trying to do this, but make sure of your lower back here. If you want to open it, just open, go close to the wall and open like this way. So no pressure, no movement on the pelvis, forward and backward. So pelvis locked. So these are the simple stretches that you can use. If you want to go more deeper and more deeper for the shoulder muscle stretch, so you can go towards the corner of the wall. If I look at over the corner of the wall here, so just place your hand here, right? Place your hand here. So place your head here, hands on the side, and just rest and feel the opening. So this is a corner stretch, you can do it. So you can use so many ways. If you want to stretch your shoulders, this you can do. Strap we have, take use of the wall. Nothing you have, just bring your hands like this way, as we have discussed earlier in the thoracic spine too, and try to do this. Hold it for 20 to 30 seconds and then release. So these are the different stretches which we can use for the shoulder muscles. So I hope this must be clear to you guys that how to avoid this. I have seen so many times that you are trying to do this. So see what is happening in this stretch, how much pressure you are putting on the shoulder blade here. How much pressure you are putting on this ball and socket joint. You are putting your all body force. So this sometimes give you the more damage if you are doing this stretch. So no need to create all the body weight here. Rather than this, you can come into the sitting position easily. You can hold it yourself here. So simple stretch again. 1, 2, 3, 4, and release. So with the beginners, we have to go with very simple way. If you are advanced, you want more deep shoulder opening, then you can do that stretch, which we have discussed earlier right now, that putting the body weight, if your shoulders are healthy. But mostly the problems with the beginners is, shoulders are immobile, stiffness is there, because of the nature of the job, lack of mobility, lack of viscous fluid inside, arthritis, degeneration, so many reasons we have, any pre-existing injury. So we must have to protect our shoulder joint, and this is mobile joint, so we have to take care of it. More simply, if you want, like if you don't want to go more deeper, and with other techniques we can use easily that we have to be focused easily that how to balance it, right? So this you can do, thread the needle. So here we go, do this and this. Do this way, this is threading the needle. This. Hold it here, threading the needle and this. No need to get any movement from your lower back, just we are using for the shoulder joint. And this. So these are the simple stretches that you can use with the beginners, or this is the preparatory exercises or the stretches before to go into the backward bending, forward bending, twisting and other poses too. Because if your shoulder muscles are relaxed easily, you can engage more movement from your thoracic spine too. And then there is no extra pressure on your lower back. So I hope this must be clear to you, friends. And as we go through again, the shoulder girdle, 3 bones that forms scapula, clavicle and humerus. Collarbone, shoulder blade, arm bone. If you look at here again to the skeletal system, from the front view, this is the S-shaped bone that we call the collarbone, clavicle. On the back, if we go, Scapula, the triangular shaped bone on the back of your body. Then on the side, we have a humerus, the arm bone. So these are the different bones that forms the shoulder girdle, and try to avoid this pose, this posture in your activity of daily living. It gives you more internal rotation. That's why external rotation is difficult for you, because over tightness of this muscle, they don't allow you to stretch onto the opposite side. But we must have to gain the range of motion, so that's why slowly we can do the stretches. And these stretches also you can do in your activity of daily living like this. This is easy. Hold it like this way and open the chest. Clasp your hands on the back of your head. Open like this way. So these different stretches we can use for the shoulder mobility. So I hope this is a little bit clear to you. So first and foremost, to take your client into backward bending and the other poses too, specifically in backward bending and twisting and shoulder stand, try to check their stiffness in the shoulder, how much mobility they have. Practice these exercises, stretches, and then allow them to get into the pose. So this is the prevention, guys. You can prevent more injuries with your students, and then they can make use the good effect from the poses rather than the injuries. So try it with your students, with yourself, and make sure no injuries has to be there, and then feel the difference, feel the range of motion. Come back to us. If you have any questions, any queries, you are most welcome. Thank you so much for this class today. Have a nice day. Namaste.